260,000 vouchers are available. For more on this, the department's acting chief director, Lesley Bamford, joins us. Lesley, thank you very much for your time this afternoon. Now, this attempt of a 100 Rand voucher to the elderly, what has informed it? What are you seeing with the patterns in terms of vaccinating?
Well, good afternoon and good afternoon to the viewers. So I think everyone is aware that our primary target for the vaccine rollout, our primary focus is to vaccinate adults and particularly to reach older persons, people 50 years and older, and especially people 60 years and older, because we know that they are most vulnerable to contract severe COVID disease and to die from COVID infection. So we have been receiving feedback that one of the barriers to vaccination relates to resources. So people having insufficient resources to, for example, pay for transport to access one of our vaccination sites. So this program, it is a pilot program. It is not funded by government. It's funded through some of our partners. And as you correctly said, during November, we are offering grocery vouchers to people 60 years and older to offset the costs associated with accessing one of our vaccination centres.
Okay, so my understanding is that we're going to have the grocery vouchers, and then there's the additional 100 Rand voucher, which will be specifically for transport, just for clarity. So,
no, the 100 Rand is a grocery voucher, or it is a voucher that can be redeemed at Checkers, ShopRite, or USave. So it's not, we're not paying directly for people's transport, but we are hoping to offset the costs that people might, the money that they would have to pay for transport or for anything else that they need to access one of our vaccination sites would be offset by the 100 Rands worth of groceries that they can purchase once they have obtained the voucher.
No, certainly a great initiative. But do you not believe that perhaps you're open to that possibility that they might go and get the grocery but still not manage to come to vaccinate at any of those vaccination sites?
Well, the way the system works is that people only receive the voucher once they have been vaccinated. So it is coordinated through our electronic vaccine data system, the EVDS. And as you know, everyone who vaccinates needs to be registered on that system. And during the month of November, anyone 60 years and older whose vaccination is recorded on the EVDS will then be eligible to receive the voucher.
Should this trial process actually go very well, would you perhaps look into having it even for perhaps the younger citizens, where there's some sort of an incentive for them as well, because our numbers are a bit shaky?
So I think for now we will see how it goes through during the pilot, which, as you said, is being implemented in November. Once we have the results of the pilot, we will make a decision whether to carry on with this and whether to extend it to other age categories.
Okay, and then just in closing, in terms of the numbers currently, we're speaking of a fourth wave. When, as the health department, are you expecting it to hit us?
So the estimates have shown that the fourth wave can be expected towards the end of the year. Of course, we don't have clarity, and it depends on a number of factors, including the extent to which people continue to stick to the regulations and follow the non-pharmaceutical interventions.
No, very understandable. We'll just observe the numbers now coming out of the local government elections, which saw a lot of movement and people congregating in spaces together. But thank you very much for your time. That is Lesley Bamford, Acting Director of the Health Department, talking to us there on their incentive of 100 Rand grocery voucher for those over 60 to vaccinate.